This is Office RX, where we prescribe solutions for smarter medical practice growth. Brought to you by PAHCOM, the Professional Association of Healthcare Office Management. Are you ready for today's dose? Let's get started. Hey everyone, welcome back to Office RX, the podcast where we dish out practical tips for medical practice managers like you. I'm Trinity, and I'm here with my co-host, Marcus. What's up, Marcus?
Hey Trinity, just ready to help our listeners keep their practices running smooth. Today, we're diving into a heavy but important topic, medically assisted suicide, or medical aid in dying, or MAID. It's a big deal for practice managers, especially with laws changing fast.
Totally. This isn't just a clinical issue. It's got legal, ethical, and operational layers. So let's break it down for our listeners. Marcus, where is this legal in the U.S. right now?
As of 2025, medical aid in dying, where a doctor prescribes a lethal medication for a terminally ill patient to self-administer, is legal in 11 places: Washington, D.C., and states like California, Oregon, Washington, and New Mexico, just to name a few. Oregon kicked it off back in '94 with the Death with Dignity Act. But here's the thing, euthanasia, where the doctor administers the drug, is still illegal everywhere in the U.S.
Right, and the numbers show the legal option. MAID is not very common. In the state of Oregon in 2022, only about 0.6% of deaths were from MAID. It turns out to be 278 people, mostly cancer patients. But Marcus, what does this mean for practice managers?
It's all about compliance and preparation. If you're in one of those 11 jurisdictions, you need to train your staff on the rules. Think patient eligibility, like being 18, a state resident, and having 6 months or less to live. Plus, there's paperwork and lots of it. Oregon, for example, wants detailed reports sent to the state.
Mess that up and you're in hot water.
This liability risk is credited, at least in part, with the low patient use cases.
Oof, paperwork risk can be tricky, right? But seriously, even in the 39 states where it's not legal, patients are still asking about it. 17 states are debating MAID laws right now. So managers need to be ready with compassionate answers and maybe point folks to palliative care options for now.
Exactly. And let's look global for a sec. Places like Canada, Belgium, and the Netherlands allow MAID or even euthanasia. Canada's numbers are wild. 3.3% of deaths in 2021 were MAID-related. That's over 10,000 cases. The Netherlands is at 5.1%. It shows how demand could grow here if more states approve the procedure.
Wow, those numbers really put it in perspective. So whether you're in a state where it's legal or not, it makes sense to have a plan for patient inquiries. Marcus, what's one thing practice managers can do today?
Train your team on patient communication. Use education and training resources like the PAHCOM education calendar to access webinars on handling tough talks like this. Especially paired with communications networks like the PAHCOM forum, it's a game changer for keeping things professional and caring.
Love that. And don't forget cybersecurity. MAID discussions mean sensitive patient data, so your EHR systems better be locked down. HIT CMPPs are certainly on top of that. And for those of you unfamiliar, that's the credential based on tech that practice managers need to know.
You bet. Pew Research shows 49% of Americans support legalization of medically assisted suicide. This topic's not going away. Stay sharp with professional networks, whether at PAHCOM or your specialty meetings. Education, training, and networking make all the difference. And if you're not a certified medical manager yet, look into whether current grants are available in your state. Keep your practice ahead of the curve.
Couldn't have said it better, Marcus. All right, folks, that's your dose of Office RX for today. Grab those PAHCOM tools, train your team, and keep your practice ready for anything.
Absolutely. Until next time, see you at the forum.